Hey, it's Glenn the Flying Dutchman, and welcome to this brand new segment called Health Sense on 1FM 91.3, brought to you by Glen Eagles Hospital, Singapore, on your side.
So Health Sense is a monthly series. We're going to be talking to a collective of medical and wellness specialists about a wide range of health matters.
And the theme for today is Get Your Heart Racing.
Next up, we have another doctor from Glen Eagles Hospital, Singapore. He is a urologist, and we are talking about Dr. Ho Siu Hong. What we're going to be doing is we're going to be talking to Dr. Ho about testosterone, an issue with men. I mean, it's important. As you get older, we have all kinds of worries with testosterone. Dr. Ho, thank you so much for joining us.
Thank you.
And I'd like to ask our Facebook viewers to please continue to send your questions through, all right? I'll be reading your questions. Right?
So we've been talking about getting our engine started.
Yes.
But getting from first gear to fifth gear, it's difficult sometimes. When you hit the gym or when you're working out, for men in particular, testosterone levels increase through regular workouts. Am I right to say that?
Yes, you are right.
What are the factors that affect that increase?
Well, all of us men need some level of testosterone. I mean, it keeps us going, keeps our mind active, keeps our bone and muscles healthy. But unfortunately, with age, testosterone tends to decline.
Yeah.
The issue is then when we are dealt with a situation where testosterone declines quicker than what we expect it to be, I think that becomes then a health issue.
Okay.
Yeah. So how do we maintain testosterone level? One of the best ways is working out. By working out, it stimulates the body, and testosterone is produced mainly by the testicles, and the testicles will automatically produce a larger amount of testosterone. Secondly, testosterone is stored in our body after it's been produced.
Okay.
And it tends to be trapped and made unuseful in our fat cells.
Ah.
Yep. So if you reduce the amount of fat cells or content in the fat cell, we actually liberate this own manufactured testosterone.
Okay. A lot of men, this is a worry. I'm sure there are guys watching us now going, so at what age is my testosterone going to start to dip?
Okay. Usually we'll have pretty good testosterone till about 40 years old, unless we have serious health issues or something like that, all right? But we also go by symptoms. If a man feels that he's healthy at 55 years old, and he's able to do everything that he's able to do when he was in his younger days, then I think there's no reason to suspect so. But if we find that mentally we are slowing down, short-term memory is getting poorer, concentration is getting poorer, we are not bulking up even though we are hitting the gym 5 days a week,
Yeah.
I think then we should get our testosterone checked.
So here's the question. Is it only if I hit the gym, or do different types of exercise lead to different levels of increase in testosterone?
All right. Testosterone is usually associated with muscle bulk. So if you talk about needing testosterone or looking at the effects of testosterone, we probably look at muscle bulking more than stamina or resistance kind of stamina kind of training.
Okay.
Right.
So we
because
need
you can't build muscle without testosterone.
Literally that. Yeah.
Okay.
Interesting.
So I'm looking at him right now, and he has very little testosterone.
Well, there are two ways of.
Thanks, Glenn.
Sorry.
There are two ways of just eyeballing a man to see whether he
exactly.
has sufficient testosterone. One of it is to look at how hunky he is.
Yeah.
And the other one is to look at his waistline.
Oh, don't look at my waistline. Please don't look at my waistline.
Yes.
Can I cover this up?
So the
difficult.
size of the waistline, unfortunately, is inversely proportionate to the amount of testosterone that he may have.
Okay.
See, this is not making me feel good now. I'm feeling all weird now. I'm trying to breathe in. I'm absolutely trying to breathe in. A lot of people, at least I know people, who I think are over-exercising. They exercise to the point where they're in pain for days.
Yes.
Does that affect, that would lead to an overproduction of testosterone?
No, in fact, it's the other way. Anything that goes on the extreme goes into what we call the breakdown kind of situation. All right. So if that happens, then the brain will not actually stimulate much more testosterone. You see, the factories in our body have certain natural limitation.
Right.
All right. So the same. It doesn't mean that we study 24 hours a day, we get brighter. We reach a certain limit. All right. So exercise in terms of stimulating natural testosterone production has to be also moderated, so that it's at a level where it is just sufficient to stimulate and not destroy.
That's interesting.
Yes.
The other question then is work stress, family stress, just general stress. Does that bring your testosterone levels down?
Yes. In fact, there are a few other factors that bring testosterone down, but stress is one very common factor in Singapore because we do live in a stressful society. How do we measure stress? There's no clear measurement of stress, but generally it's the amount of sleep that we get. So if we get inadequate sleep, or we get disruptive sleep pattern, for example, a lot of traveling across time zones,
Yes.
night shifts and all that, waking up 3, 4 o'clock in the morning, coming to work.
Doing a morning show?
Yes.
Yes.
So all this can affect the natural biological cycle.
Right.
And the natural biological cycle, the sleep pattern, is actually very important for normal testosterone production.
So what is a normal sleep pattern?
Well, we should actually sleep when it is night, and we should hopefully have at least 7 consecutive hours of sleep to get a restful body.
When you say 7 consecutive hours of sleep, that means it shouldn't be broken by getting up and going to the toilet or anything. It's just sleep.
Right. Preferably not getting broken up, but even if it gets broken up, we do know that is it a total broken sleep or a partially broken sleep. So if you wake up to just go to the toilet and
Right.
then you go back to bed and you can fall asleep easily,
Yeah.
I think that is not really considered a disruptive sort of thing.
Okay.
But if you go to the toilet and then you spend the next 30 minutes trying to fall asleep again,
Yeah.
then that may be considered a disruptive sleep.
That's interesting.
We are talking to Dr. Ho Siew Hong, urologist at Glen Eagles Hospital, Singapore. If you have any questions whatsoever, please ask us. This is your opportunity, all right, to ask Dr. Ho any question, with regard to, we're talking about testosterone right now, which brings me to my next question,
Okay.
which is there are a lot of testosterone supplements out there.
Yes.
Does it actually work?
Well, strictly speaking, testosterone supplements cannot be sold directly to customers. Because
Really?
testosterone is considered a drug. So it's regulated and it can only be prescribed by doctors.
I see.
Wow.
Yeah, so what is usually marketed over the counter are actually supplements, some sort of vitamins, amino acids, proteins that can contribute to testosterone formation in the body.
Right.
Yeah. So you're literally purchasing and giving the body this raw material with the hope that the body can absorb and manufacture testosterone from these products.
Okay, you see, like I'm going to go back because this worries me now. Glenn and myself work under a great deal of stress. Number one, we have a very strange sleeping pattern.
Yes.
I have a very wide girth.
Yes.
How do I get my testosterone checked?
Yeah. Testosterone check is just a very simple blood test. So it's no different than the routine blood test that you get from your family doctor.
Right.
The key thing is that we know that it follows a biological cycle. So therefore, if we want to do a testosterone check, we have to do it sometime in the morning, between 9 a.m. to 11 a.m. That's where it's the highest level.
Ah,
Fasting or non-fasting does not affect testosterone levels.
okay. What would be a normal testosterone level for someone in their 30s, 40s? How would you know it was normal?
All right. There is a particular range.
Yeah.
Yes. So let's say for certain units, we talk about 12 and above or something like that.
All right.
But there's no absolute range in that sense, because if you're above the normal range, you're considered normal. You're below a certain range, for example, 8 and below, you're considered not normal. There lies a big gray area, say between 8 to 12.
Ah,
So many of our patients actually lie in this area.
right.
So we need a combination of what they call biological blood test result combined with a set of symptoms, like what we mentioned earlier: mental function, bone density, muscle mass, as well as erectile function
Right.
and libido.
So let's say someone is below 12.
Yes.
Let's say you're 9 on the
Yes.
scale.
Yes.
what would a doctor then do?
Yeah. I think the first thing we look at is identify lifestyle factors.
Right.
Like what you obviously say, manage stress.
Yeah.
All right. Reduce a bit of weight. Start some exercise program. I think, and usually it can actually push testosterone up by about 10-20% by just simple lifestyle adjustments.
Wow.
So eating better and all will help a lot.
Right.
So in situations where we have adjusted lifestyle, we have done everything we can, and yet we don't get the result that we want,
Yeah.
both from the symptom point of view and from the biological point of view, then we have to talk about external testosterone replacement, and that's usually done by the doctors.
Ah. Okay. Okay. That's interesting.
How do I know if I have enough testosterone?
Yes. So first of all, ask yourself, do you have all these symptoms of low testosterone? Memory problem, muscle bone issues, sexual problems, all right? If you have any of these boxes ticked, then you may be having low testosterone. Coupled with a blood test to show that the blood levels are below normal, then only would we call a person low testosterone, or the medical term is called hypogonadism.
Okay.
Yeah.
So technically, is there any way for me to have excessive testosterone? No, because if I over-exercised or something, the brain would shut down the production of testosterone.
Yes. So technically, you cannot have natural excessive testosterone. So the body is a wonderful self-regulating mechanism.
Right.
But the only way you can get excessive testosterone is that if somebody is feeding you testosterone from externally,
Like how?
like maybe a testosterone supplement, which
Okay.
is in the form of a pill.
Yeah.
It can come in the form of a gel or even an injection.
And sometimes athletes
Yes.
do that
Yes.
illegally.
Yes. I mean, we have seen many world famous athletes having their Olympic gold medal stripped off. And I mean, we have known one very famous sprinter in the world. I mean,
Yeah.
he really looked very bulky. And even before he was stripped of the gold medal, many people commented that this guy looks exceptionally bulky.
Shall I mention his name?
Let's keep quiet on that one.
Yeah.
It was many years ago.
Yeah, many years
yes,
ago.
yes,
Yeah.
Yes.
Ben
So-
Johnson.
Yeah.
I asked you not to do that.
It's okay. Everyone knows.
Everyone knows. So exercise, diet change, controlling stress, these are all going to help me improve my testosterone level.
Absolutely.
Is there anything else?
Well, if all this fails,
Yeah.
then a man may require a little bit of assistance from the doctor. Now, we are not talking about dependence on testosterone,
Right.
but a man may need a push or just a slight boost. That's where he can discuss with his doctor, and if it's proven that he has low testosterone, his doctor might prescribe him a short course of testosterone to achieve some of these objectives first.
Okay.
It's actually the chicken and the egg, you know. Most men who have all these health issues are not motivated, and they find frustration that they hit the gym so many days a week and they're not getting results. So a short course of testosterone may actually give them a little bit of result, start the ball rolling, and they may get motivation then to adopt a more healthy lifestyle.
Ah, okay.
So a sleep pattern is one example.
Yeah.
You need sufficient testosterone to sleep well. So it's both ways. If you don't get enough sleep, your testosterone won't be good.
Right.
But you need a bit of testosterone to sleep well. So if you get a bit of testosterone, sleep pattern gets better, the
Yeah.
body automatically then will produce more natural testosterone.
Right. Interesting.
Dr. Ho, I've got a Facebook question here from Amresh Kumar, who's asking, does low testosterone equal being more susceptible to diseases like prostate cancer?
No. In fact, it's the other way around. You need a bit of testosterone for prostate to grow, as well as for prostate cancer to divide and spread in the body. All right? Yeah. So having low testosterone may so-called protect a man from these prostate-related problems. But having low testosterone leads to another set of unhealthy health issues which we have to address.
I've got another question here from Jason Hoon. Thank you so much for all your questions on Facebook.
Thanks, guys.
What are some of the possible side effects if I take external supplements to boost my testosterone levels? I was about to ask you that earlier on because, you know, there've been talk that if one were to illegally increase his testosterone level, he might go bald. Is that true? Is that any truth?
I've heard that.
Yes.
Too much testosterone will make a person go bald.
Well, they call it the male pattern balding, and that's related to testosterone.
Oh, it is?
Yes. So it is not a direct correlation, but there have been cases where excessive amount of testosterone can lead to hair loss, particularly the male pattern hair loss. Now, if we are talking about controlled, moderated, doctor-prescribed doses of testosterone, I think it is fairly safe because the doctor will prescribe and will do blood tests to ensure that the levels do not overshoot the safety levels.
But there's so much on the internet that I can
Yes.
buy that they say will increase my testosterone.
Yeah.
I think that's
Now,
his worry.
These unsupervised administration of testosterone can lead to a whole set of side effects. One particular side effect that we really do not want is that excessive thickening of blood. And when blood thickens, it can lead to heart attack or even stroke event. These are catastrophic events. Number two, in young men using excessive amount of testosterone, it will definitely affect their reproductive capability.
When you say, let me stop you there. When you say young men, what sort of age group are we talking about?
Well, men can reproduce easily up to 50 years old, isn't it? Yes.
So anyone through to 50?
Yes,
Wow.
but it is particularly more catastrophic if you're talking about a 20-year-old man desiring to have a quick result in the gym, taking excessive testosterone, and if he had taken it for a long period of time, this can permanently affect his ability to produce good quality sperm.
Right.
Wow.
And I think that's happening very, very
yeah.
often
Yeah.
Yes.
these days. You know,
I think
because everyone is so impatient. They just want to get results real quick.
Yes, yes.
So don't do that.
Absolutely not. We're talking to Dr. Ho Siew Hong, a urologist with Glen Eagles Hospital, Singapore, and we've been talking about testosterone. Dr. Ho, thank you so
Thank you very
much.
much.
It's been my pleasure.
Thank you.
Thank you.
Good times. Greatest hits. 1FM 91.3.